I'm Jenifer Rhynes. I'm the director of the YMCA by day, but I also chair the Heal Slow Committee, Healthy Eating, Active Living, and that is a coalition of most of you in this room in one form or fashion that work together to prevent and reduce our obesity issues. And so I'm here to share some of the data over these years that we've been doing this. And so it began as an effort with the County Board of Supervisors, funding a childhood obesity summit. And in this process, we learned a lot about our local issues and how we address those. And so that was really the fuel to help us start our plans with Heal Slow and work together toward those ends. One of the things we discovered in that process is there was a lot of denial in this county that Missouri was overweight, but San Luis, people hike and they ride their bikes, and so it wasn't our problem. Yes, the United States had a problem, but we were special. And in fact, you can see that's not true. In 2006, we had significant childhood obesity, and as the years went by, it didn't get better, even though we were working toward that end. And so even on the fitness side of things, fifth graders see a little bit of improvement, but certainly 7th and 9th graders are not improving. And when we get to the preschool data, it's also disheartening. And so we know that as kids get older, these numbers are likely to increase. You can see the trend. We know how dots go as we look through that. A little more data for you. This PowerPoint, I'm going to flash through it pretty quickly, so if there's some data here you want to capture for some future discussions, it will be on the Heal Slow website, and you can download it and capture any of the data that you need. And so a Healthy Communities study shows us that even though kids, a relatively large population of kids live close enough to school, the subsequent study shows us that they don't walk or bike to school. That was one of the issues that Heal Slow wanted to address. And so this brought us to some of our understandings. We knew that it wasn't necessarily a culture of not walking. Perhaps there were some other issues. And so as we began to do some of our research and implement some programs, we learned that, that sometimes it was a discussion at the doctor's level, that doctors were not having what we might say the courageous conversations with their parents or with the adults in the lives of kids. And so we came up with a walking prescription. And so all the county parks and rec directors worked together and paid for the production of this walking prescription pad, and it had all the local trails by region that were beginner level, so that they knew where to park, they knew what to bring, they were told to bring sunscreen, they were reminded about their water, and these were on multiple occasions distributed to doctor's office so that it could be an entree for that conversation. And so Heal Slow's role in that was to get those distributed to the doctor's office and encourage them to implement that in their process. That was a relatively inexpensive thing to do. The trails existed, the Parks and Rec directors were willing, the planning departments of those cities got involved in creating those trail maps for us. So we were able to do that without much funding. That funding existed in the city budgets and the state budget. But not everything was that cheap to do, and so we were able to secure a grant from the California Endowment, that's TCE, and we did some pilot programs. The most interesting thing about those efforts to me was the learning around recess before lunch. Now, you would think that when you know that having recess before lunch encourages healthy behaviors in kids, that it would be a no-brainer to do. Very difficult to turn those school ships around and put recess before lunch. And so these were the first 2 pilot schools that were able to implement that and see the benefits and the results of just such a program. Other kinds of programs that we implemented were Rethink Your Drink, and there were lots of presentations that were given to kids. And kids now, if you go to many schools and you ask them how much sugar is in this soda, they can tell you precisely how much it is. I went to Grover Beach Elementary yesterday, and they had posters up about this very thing. So we know that these kinds of programs are working on the minds of kids, but we also need to work not only on the drink side of things, but on the snack side of things. And so there was a Go Slow Whoa program that helped kids understand that there were green snacks, good snacks, eat as much as you want of those. There were snacks that you go lightly with, obviously yellow, and then there's some snacks that were really occasional treats. And so kids can tell you, if you hold up a Twinkie, if that's green, yellow, or red. And that was a really good learning experience for those kids. Walk to School Day was another effort around walking and helping families understand that it really is possible. And this came out of a Dr. Jackson talk. He's here today. And when I heard that if the average overweight 10-year-old walked to school, he'd lose 10 pounds in a year, that was like, well, that's easy. Not so much. Cal Poly helped us with the survey there, and there's a lot of fear with parents around letting their kids walk to school. Although walking with them sounded like a really good solution to that for me, it didn't seem so easy for them. And so we're beginning to learn about the built environment in the response there. No sidewalks, fears around the crime in the neighborhood, and those kinds of things. And so we know that we have some work to do in order to get this behavior implemented across the county where it's possible. Now, you remember back to that slide, there's a good number of kids who live more than 2 miles away from school. So obviously that's not going to be their solution. Just like the tobacco efforts, it's a multi-level effort. It's more than education. Policies need to be in place to model good behavior, and so our very first policy was the buy local policy, and that's now currently the county's policy. So when they purchase food, they're looking for local fresh fruits and vegetables, a good model for all of us, obviously, whether it's on an individual level or some of the cities now may be able to follow suit now that they see that it's really pretty easy to implement. We have lots of opportunity in this county. So we aren't out here isolated all alone. Obviously, the nation recognizes that they have this problem, and of course, Michelle Obama has taken this on. And so Heal Slow capitalized on that momentum with Let's Move, and twice we've now had a Let's Move campaign. And we've encouraged people to do a number of things with our Let's Move campaign, including get active, eat around the table. Another fascinating thing I learned, people who eat dinner around the table are more likely to eat less food and more nutritionally. Never mind all these other social benefits that they get. And so just by sharing that, instead of having dinner in the back seat, we could improve life in a lot of different ways. So we've also created a Healthy Communities Month, and that capitalized on a lot of good things that were happening already in this county. And you can see year 1 versus year 2, the number of activities increased. So what's next for us? There's any number of possibilities, and that's what's really great about working with a coalition. Sometimes it's born out of Heal Slow because we were all at the table and 3 people saw that they had a common interest and could work together toward a better end. Sometimes it is the entire Heal Slow effort. So there's lots of possibilities, and you can see farmers markets, community gardens, food access in low-income neighborhoods, trails and bike lanes, and honestly, walk to school, that's the biggest barrier, the perception that there isn't a safe route to school. Supporting healthy physical activities in the workplace, promoting smart growth, implementing other kinds of infrastructure, and supporting that. And so I'm here to encourage you, right on time, mind you, to join us on November 14th at 2 p.m., and we can encourage your support of our efforts, but only through a collective effort can we move great mountains. And so we'd like you to be part of that. I promise you 2 benefits. The group collective effort, many hands make light work, but the networking that goes on in that meeting is really phenomenal. And look at the nodding heads. Everyone's saying, yes, sitting around that table, I made some significant connections that helped us get a grant, that helped us move our project forward, that opened a door so that we could accomplish great things together. So I'd love to see you there next month.